morning. A warm welcome to all my students. Today we are planning to have a discussion on the case note of Karen Chan. Here, a nurse is writing a letter to Mr. George Janak, is an oncologist. Okay, so directly we are going to the case note. And we all know that whenever we are getting a case note, the first thing that we have to determine is that to whom we are writing. We know that we are writing this to George Chernat, and what the task is there, we are going to read the reading task. Using this information, write a letter to George Chernat, oncologist at Solihull Hospital, Cliffbridge Road, West Midlands, UK, and CV2 3RL. And what we are expecting from him is that to request further evaluation and its management. So we need further evaluation and management. Okay. So we clearly know that we are writing to a doctor. So when we are reading the case note, we should have to keep in our mind that we are writing to a doctor and doctor needs some specific details that only we have to include in the letter. Okay. So coming back to the top of the letter. Okay, details are here. You are Heidi Say, a qualified nursing sister working under Biomatics Health Clinic. Karen Chan is visiting at your clinic from 3rd March. So the patient is visiting your clinic from 3rd March onwards. And detail of the patient is given, Karen Chan, aged 44. Obviously, we know we need both these details. Address, it's not at all useful. Phone number, no need. And allergy to nuts. That also we have to include. I mean, in this, we need the name and age and allergy to nuts. Only these two things we have to have from here. And social background is given. Married, lived with husband and son. It's needed. Work as safety manager, not at all. Fond of fast food, drinker, smokes 10 to 12 cigarettes in a day and overweight. So these things we have to include. She is fond of food, is a semi-relevant point, but drinker and smokes, that we have to definitely include. And along with that, and don't forget to use the term that she is overweight. Okay, coming back to the medical history, we can check the medical history of this patient. PCOS is there, had endometrial hyperplasia, excessive irregular growth, irregular menstruation since March 2019. 1, 2, 3, 4. All these 4 things are needed. Splenectomy done in 2001, cholecystectomy done in 2014. It's both are irrelevant because it happened a couple of years back. So we are not only going to include these 2 points. Okay, hypothyroidism on thyroxine 0.5 mg. She is having this medicine, so that also you have to include. Okay, the next extract is our family history. Mother died with uterine cancer. We have to include because when you come to the next part of this one, you will understand that it's fine. We have to include that also. Father has diabetes. It's not a relevant one. Okay, now we are going to discuss about the first visit that happened on 3rd March 2019. Came to the hospital with severe vaginal bleeding, weight loss, pain while urination, pain during intercourse, pain in legs and back, pelvic pain, anorexia, tiredness, unable to do daily activity. All these things we have to include. Okay. Then come to the medical background, TFT, TVS, to find the presence of polyp, complete blood test. These investigations we already performed on the first visit itself. So we have to include these investigations too. And hysteroscopy, Panadol BD, recommended for review with lab reports. Okay, so these things we have to. We are writing about the last visit, so there is no need to include from here. That we will do it later. Okay, so the next visit happened on 4th March, that is the very next day. Unusual vaginal bleeding with foul smell, pus like or blood tint. constipation, bleeding from bladder and rectum, ascites, lip edema, advised for pap test and biopsy, WC increased, and FP fall, electrolyte imbalance. All these things are needed. Okay, notice the bullet point. And the last visit she had on 5th March, trained at home, accompanied by her son. This accompanied by her son is a semi-relevant. If you wish, you can. Otherwise, leave it, no problem. But this profound vaginal bleeding, intense pain scale is given there out of 10, 9, and breathing difficulty, pap test showed abnormal cell growth, then blood in stool, UTI, BP, 90/60, and biopsy, MRI scan, CT, X-ray, but all these reports are pending. So we have to include all these things in our letter. Coming back to the discharge plan. Discharge plan, endometrial cancer, a question mark is there. So it's not at all sure because we didn't get the biopsy CT report. So after getting the report only, we can confirm the diagnosis. So we are suspecting endometrial cancer, not at all sure. And the discharge plan, the last is require further assessment and treat. Okay, so now we are going to discuss how to write this information, how to make this information to a complete letter. Okay, for that, the first thing that we needed is the date, and always we are writing the date on the top of the letter. So the date here is given 5th March 2019, and this 5th March 2019 is written in expanded form, and when you are writing in your letter also you have to go with the expanded form, the first thing. And next comes the address. Here the address is given. You can see this is the address, Georgiana, its designation and the name of the hospital, and okay, so we can check how we can write this one. Look, you can see here date 5 March 2019. It's an expanded form. So whenever you're writing the date, you just remember one thing. First, you wrote in expanded form. That's why wherever you are writing dates in your letter, you should have to follow the same format. Any confusion? Oh, no. The next is the address. It's Dr. George Jannard. Both G must be capital, oncologist O capital. Solihull Hospital, Cliffbridge Road, West Midlands, UK. Okay, we have to write the address in this way. The next one is your salutation. We are writing to Mr. George Chernard, and we need only the second name of the person. So write Dear Chernard. And don't forget to give a comma, then reference Mrs. Karen Chan. Here you have to write the full name of the patient and age 44. You can write 44 years, 24. If you're writing 44 only, no problem. The next is your introductive part. In introductive part, what we have to include the name of the patient and full name of the patient. Remember, we have to write the full name of the patient in the introductory part. And what the condition of that one, and to whom we are writing what we are expecting from that particular person. That means here we are writing to Dr. George, and what we are expecting from George, and what is the condition of Karen Chan. These three things we have to include. Okay, so it's a sample one. You can go with this one, or else if you have another option, you can go with that also. But these three things you have to be included in your introductory part. I'm writing to refer Mrs. Karen Chan, who signs some symptoms of suggestive to possible endometrial cancer. She requires further assessment and treatment for her speedy recuperation and is being discharged today. Okay, so first paragraph finished. The second paragraph, we are writing the timeline, recent history. Here the recent history is the 5th March when she was admitted to the hospital. So we will write the details here, the paragraph number 2, details of the last visit. And if you wish, you can mention the date, but not in this form. You have to go with the expanded form. Okay, and we will say the details that when she fainted at home, vaginal bleeding, intense pain, breathing difficulty, and we took the vital signs, and you can include the vital signs details, and she was suggested to have the investigations. I mean, had the investigations, biopsy, MRI, CT, X-ray, but the results are pending. These things you have to write in the paragraph number 2. Now we are going to discuss about paragraph number 3 and 4. Your choice is yours because if you wish to write in one paragraph, you can write it. But if you feel that the paragraph is too big, you can go with two paragraphs, that means 3 and 4. Okay, in 3 and 4 paragraphs, we are indicating the past medical and social history of the patient. Okay, here, the past medical history means we are writing about her previous visits. Her visit first happened on 3rd March, and we will give the details on that particular day why she came to the hospital. She came because of vaginal bleeding, pain while urination and intercourse, leg, back, and pelvic pain. Right, this is the condition of her, and we are writing in detail all the conditions there. Okay, and what the investigations carried out there, that also we write. We carried out, they carried out TFT and TVS. We will write about that investigations also. And this continuation of that paragraph, the next paragraph, uh, details of the second visit. Again, vaginal bleeding, but foul smell was there, and she has had constipation when bleeding from bladder and rectum. And also from the previous test, we understood that WC increase and SP fall. So these two things we have to write. And the past medical history, that means she had PCOS, irregular menstruations, and the reason for her death, reason for mother's death, that because it's happened because of uterine cancer. These things we have to include, and along with that, we will say that she's allergic to nuts. This all is about her past medical history. Now we have to say something about her social history, and her social history is not at all much there. Only that we know of her is that she lives with her husband and son. We will indicate that also. And the last one, not last one, the paragraph number 5 is the recommendation paragraph. And we are recommending what we feel about the patient. That means you have to. So actually, we already said in the first paragraph that it's a suspected case of endometrial cancer. So just don't stress that on much here. And what you are expecting from him, that means you need further assessment and management. And we are talking about the biopsy report, and you will say that the report, not only I wrote the biopsy only, the biopsy is pending, MRI is pending, CT is pending, X-ray is pending. There is no need to go for the listing. You can say that the, etc., test results are pending. You can write like that. A problem. And paragraph number 6, it's a usual one. Your further carries upon this letter will be a matter of appreciation. You can use exactly like this if you wish. Okay, you have some other options, you can go with that, no problem. And here we know the person to whom we are writing, so we will say yours sincerely, and Heidi say registered nurse, and you write the name of the institution where you're working. Okay, that's it. Hope you haven't have any doubts about this explanation, and if you have any doubt, please come on comment box and comment your doubts, and we will try to meet you as early as possible with your answer. Okay, thank you. If you like this video, please like it, share it, and subscribe it. Thank you. Thanks a lot.